So you say you should be doing this. This is not your job, Zul. Your job is not to be earning money for the government. Your job is to have a good healthcare service. Earning money is not a part. Don't take on that extra duty of generating the income for the healthcare system. It's not your dream. Um, okay, this issue of healthcare is something that PSM takes very, very, very seriously. Because though it's bruised and battered by what's been going on, the Malaysian healthcare system is still a major presence in our lives. So if you look at outpatients, look at these outpatients. About 63 million went to government hospitals in 2023. And I think the private also is about that amount. If you take about 10,000 private GP clinics, if you take 20 patients per day, 25 days, you get about that much. So about half the outpatients are being handled private, half are in government. But inpatients, about 75%. So despite all the battering the healthcare system has taken because of low budget and all that, it is still a very significant player in people's lives. And I think it's not just a question of delivering healthcare. The kind of healthcare system you have, in a way, defines the nature of your society. Do you have solidarity with those who are poor, with those who are old, with those who don't have resources? And how we handle that tells you a lot about the soul of the nation. You can talk a lot about, masyarakat penyayang, caring society. But you don't have a healthcare system that gives good care to everyone, then your talk is empty, easy. So I think in a very important way, healthcare system defines what we are as a people. It's a very important thing that we need to preserve. But unfortunately, in Malaysia, there's been a lot of pressures on the healthcare system. This is a new private hospital, like in Ipoh. We just had a hospital called Sunway set up. When Sunway was set up, about 12 doctors from Ipoh GH left to join Sunway. And another 4 doctors from other government hospitals left to join Sunway. And we found out that the Sunway staff, senior people, go and see a doctor and say, look, you come, we guarantee you 70,000 a month. If you don't make 70,000, we'll top you up to 70,000 for the first year. So government doctors get about 10,000, 14,000 specialists, 10, 14,000, talking about 70,000 guaranteed per month. These are not doctors who are trying to go out, So let's go and actually, induce them to go out, You're aggravating the brain drain. It's not like I say, government private hospital and government doctors sometimes think maybe I should go and all that. No, it's actively going and dragging doctors out. And you only have about 25% of the specialists with experience of more than 5 years after becoming a specialist. Only 25% of them are in government. The majority are in the private. So we drag doctors out. So like in Ipoh GH, some of the doctors who went out, the cardiologist, this guy does EPS, the electrophysiology. The only oncologist went out. Respiratory physician, the only urologist went out. So, it just affects treatment. When the urologist goes out, what happens is GHKL will send a urologist, visiting urologist, maybe 2 days a month. So your things get really delayed, And so there's a big issue. One is the patients with difficult problems. The other is with the training of the younger doctors. I mean, the houseman, okay lah. The registrars and the junior specialists get trained. But the people in the master's program who won't actually need the expertise of these guys are affected. So it affects your training of your new generation of doctors because when they're in government, they can take part in the master's program, they can train doctors. In private, you're cut off in your own silo, you see. So that is the problem that we are facing there. And the thing is, if you allow private hospitals to set up, they will do it because it's big money, Like Sunway, it's about like $500 million you're going to put, to build the hospital, buy the MRI machines, buy all the robotics and all that. Then you must have a doctor. You have this thing, must have doctors, you must have a cash flow, you must attract health tourism. For the CEOs and the fellas setting it up, it's a do or die, You put 500 million, you got about 4 or 5 years to kind of come to the black, to come to a positive thing. You got some financing, you're paying your financing up. So it's, you don't care. You want to get doctors in, and then finally when you get it running up and running, then you cash out. You list it, or you get other shareholders to come in, or you sell it. You can make lots of money, is it? Give you one example from Penang. This one. From what I understand, 1996, the guy set it up, some people. Then later on, I'm not sure when, they kind of partially cashed out, and they got this one group called Affinity Equity to come in. It's a private equity group. Came in and took 78. So that means this guy's got some money from this. Then last year they sold it. This comprehensive care sold it to Island Hospital at 3.9 billion because Island is making so much money. There's so many patients coming in from Indonesia. It's a cash cow, lah. So they sell it. So if you look at that, we would have got how much? 600 million. He got 7 million because you look, he got 16% of the share, right? And he sold it for 4 million. It's 104 billion. It's 160 million per billion, right? He's got about 600. Good takings, lah. But you must be able to get the doctors, get the patients. You got to be very ruthless, lah. You got to pay 70,000 a month. Get them. And that really affects our government hospitals. So you allow these guys to carry on. And this guy's doing it. I mean, these guys are not doing it in some way because there's a need for healthcare in Ipoh, not enough health services that we serve. They want to make this is a commercial activity. It's entirely for profits. And no, it's not been driven for providing better healthcare to the region. No, okay, let's be very clear. So what we are asking is moratorium. No more new private hospitals for the next 5 years. Let the government restock. Those guys want to go out, let them go out. But don't let these fellas come in. Pull them out actively, And this is, we're not being over. We're not saying nationalize the existing private hospitals. The government's got no money to do that also, We can't do that. But they say that no new private hospitals, got enough. Let it be as it is. Let them carry on, but don't allow new ones for the next 5 years. So it's putting up as a demand, which I think the MOH is not talking about it, but we are saying, why don't you talk about it? Because even if you have a healthcare commission and you pay them a bit more, with this kind of active pulling out, offering 70,000, 80,000 per month guaranteed, who can, a lot will not withstand that, you see. So this is one of the demands that we got in our campaign. The next one is this Rakan KKM, which we are very unhappy about, because the Rakan KKM basically is the government is going to set up a private kind of clinics where people can go, they can see the doctors faster, get surgery done faster, but they pay. Maybe they pay about 70 or 80% of what they pay in the private, it's a bit cheaper. And it's going to be really expanded because now Dzul is telling employers, why not you send your doctors, your patients, instead of going to the private, let us cover you in the Rakan KKM. Okay? I know Dzul quite well. Good friend, actually. Nice guy, actually. And I don't think he's doing it for any personal reasons. There's no personal interest in this. But the friendship now is under a bit of stress because he does WhatsApp me and AY changes and all that. And my fellow scolding also. So it's a bit of a problem. But the problem is, what he is responding to is this. This is the Malaysian budget of 2024. Government expenditure was 407 billion that they estimate. And the revenue was only this. So this is the deficit. Right? So the deficit comes then from bonds, right? The government borrows the money. This is the problem. So he tells Dzul he must increase government budget. He says no. So what he's discussed with Anwar is that, okay, you give me my 10, 11%. Keep giving me that one. Remainder, let me earn it. I will earn the extra 3 or 5 billion by using my facilities, my doctors to get more money, but let me hold on to that. That won't go to the consolidated fund. That will go into that dedicated health thing and I can use it to buy MRIs. I don't have to reapply to the government. I can use this extra money that I'm earning to buy MRI machines, X-ray machines, do repairs. So that is his idea. Since the government, I cannot ask the government to give me more. The government is giving me already about 10, 11% of the total budget. The second highest after education. You know, so let me earn. I'll earn and I'll use it. And the MRI machine, once it's there, it can be also used for the third class patient. The government will use it for the private patient. So you guys don't criticize me, let me do it. But what we are saying is you only have 25% of the specialists in the country in government. 25% got more than 5 years experience. They're already not able to see patients on time. They're already long waiting lists. Then you distract them with this other service where they're going to earn something. So we are afraid that the ordinary patients, the B40 patients and some of the M40 patients also, will not get to see specialists enough. But now it's already a problem. It's going to get longer. So you say you should be doing this. This is not your job, Zul. Your job is not to be earning money for the government. Your job is to have a good healthcare service. Earning money is not a part. Don't take on that extra duty of generating the income for the healthcare system. It's not your brief. But this is the thing. Like you see, like in 2024, this is the kind of thing I tell you. So its deficit is 85,000. But there's 93 billion, sorry, 85 billion. There's 93 billion ringgit worth of bonds that people have borrowed in the past, becoming maturing in that year. Since 1998, we haven't been able to pay back the bonds that mature out of our income. So what do? We borrow some more. So we borrow for the shortfall, the 85 billion. We also borrow to cover the ones that are maturing that year. Plus 93 billion. So it is a problem. I mean, not saying it's not a problem. It is a problem. So the government looks at it and says, my God, we're borrowing about 170 billion, which means you're going to pay back, and you got a monthly, yearly debt servicing. That means you got to pay I think it's 2024, you had to pay 50 billion. Health budget in 2024, I think was about 45 billion. You had to pay 50 billion in debt servicing. And this amount is just going up, because we are not paying back. Since 1998 till now, everything we borrowed, we are rolling it over. When it comes due to pay back, we just borrow again. So memang it's a problem lah. Okay, so this is a problem. But this is the other problem. You see, government expenditure as percentage of GDP from about mid 30% of GDP in 80s has now come down to about 20%. So this is very interesting that the government previously had a larger share of the GDP as far as its income. And that has come down. So we're telling Zul, look at this. Then the government is, why is this there? And it is one of the reasons why it is there is because we are playing a game with Thailand and Vietnam and Indonesia to get FDI. World Bank will come and tell you, hey, you want to get FDI? Very good. But lower your corporate tax a bit. Because we have 40% in 1988. They'll say, okay, lower it a bit. So we lowered up. And Thailand said, you lower, I also lower. And Vietnam also lower. Because we're all competing. So now we're down to 24% of corporate profits. Thailand is 19%. Singapore is 17%. It's a race to the bottom. So so now we are like I sit in Parliament, to Mustafa Muhammad, he was that Mickey guy. So I say, why can't you guys get together and talk to the other ASEAN countries and say, can we stop doing this? Stop using lower corporate taxes to bring in FDI. Do everything else you want to do, but stop doing it. At least can you have a moratorium on that? Then he got a bit upset. I say, we're not a communist country. We can't do that. So, but they don't think about it. It's a problem. You see, our financial planners, government, EPU, finance minister, all have their minds set by WTO and World Bank. And World Bank actually is an agent of the millionaire class. You know, the kind of things they brought in, the kind of things they try to do in the WTO, open up trade, and they've messed up a lot of countries, not only as Africa as well. Food security in Africa has gone to the dogs because of these guys. You know, but the problem is our guys still respect this World Bank for us to call them in and ask them to studies or what's the next step. So that's a problem. We're stuck in that neoliberal box which you got to get out of. So the issue is this: one of the issues of why this has fallen is because of the race of the water, which can be stopped. In fact, we don't need to bring, the people, the FDI that we are trying to bring in. Our competitors in ASEAN are the big countries: Indonesia, Philippines, Thailand, Vietnam, and us. If Brunei doesn't want to follow this tax thing, never mind, like you do what you do. Singapore, they're not really that important. For the kind of FDI they are getting and FDI we are getting. For these five countries agree that we'll stop lowering FDI, our corporate taxes, it's enough already. So it can be discussed, you see. But I think up till now, there is no discussion. There's been no discussion of this. There's no idea that this can be done or should be done. You know, and it can be done. You can make a new addendum into your ASEAN Free Trade Agreement that these five countries agree to stop lowering corporate taxes, and if any country does that, then we can put tariffs on the imports from that country to other countries in ASEAN. We can do things like that. We have an ASEAN Free Trade Agreement. In the Free Trade Agreement, 99% of the goods and services being exported in ASEAN is zero tariff. But if Anil from Thailand says, I'm going to lower my things further after having a discussion, it's okay, Anil, if lowering yours, then you put to tariff of 5% on all your exports to the others among us. So we can tweak the FTA ASEAN to kind of enforce this day. It can be discussed about. Problem is, it's not been discussed. Okay, so it's important that we need to work together with these countries to try and get this. Okay, so this 2.3% of GDP is something we need to look at. Because we look at other countries, this is not really of GDP. You're talking of general government expenditure on health as percentage of total government expenditure. You see, Malaysia is at 8.5. Okay, so I think it's 2023 or something. But in that year, you can see even countries like Vietnam is more, Thailand is much more, Singapore is more than us. And of course, the kind of advanced countries. So we're chronically not spending enough on health for the last 30 years. That's why you have the congestion. That's why we have all the problems that we face in the healthcare system. Not enough MRIs, long delays. We've been chronically underfunding. And then we got to ask the government to try and spend more. So that's what we are. So this is the second thing we're asking for. So we're asking for the moratorium on new private hospitals. We're asking for KKM, Rakan KKM to be stopped. We're asking for the government to plan on going towards 5%. Not immediately. I think they will go up in stages over 5 years or 7 years. And this is an important thing you got to look at. It's something that we have analyzed. These figures may not be completely accurate. You got to take them at the 10% plus minus. But what it basically shows is of the total national income, only 28% goes to 90% of the people. Double that amount. 28 times 2 is 56. 56% goes to the richest 10% and the largest corporations. And government gets 16%. Okay. And this whole case is about 2 trillion. So, what we are saying is, the government, Madani government, should look at this and say, hey, what can we do about this? It's not that we are a poor country, like sub-Saharan Africa or something. We have enough. We have enough wealth in this country, but a lot of it is going here. So how can this part of the city, even if we lower this to 46% and take 10% and put it inside here, that's how much? 10% of a 2 trillion income is about $200 billion. More than enough for the healthcare, for pensions, for old age pension, for spending money on renewable energy and all that. So the money is there in the country, but it's not being used. And our argument is if some of this money is shared here and shared there, you'll actually increase aggregate demand and increase business opportunities, and you grow the total cake. And the whole of ASEAN, we have about 680 million people. That's double what US has. But we depend on the US market. So we need to think about those things. How do you develop the local ASEAN market? These are the kind of things that we have to think about.